5 Emergency signs of diabetes you must know. Diabetes is a common health problem that affects many people around the world. Sometimes, it shows small signs that need attention, but there are also big emergency signals that mean someone needs help right away. Knowing these warning signs can help people get help quickly and avoid serious health problems. Here are the top 5 emergency signs everyone should know about, even if they don't have diabetes. Confusion or altered mental state. Sometimes people with diabetes can feel confused or not quite themselves. Well, when that happens, it could be a sign that something serious is going on. Imagine this: your body needs sugar to work properly, right? But if you have diabetes and your blood sugar levels get way too high or drop super low, it can mess things up big time. When blood sugar levels get way high, it can lead to something called diabetic ketoacidosis, DKA. Basically, your body starts making these acidic things called ketones because it's not getting enough insulin. And these ketones can throw off your body's balance, making you feel all out of sorts, like confused or disoriented, or even cause you to pass out if you don't get help fast. On the flip side, if your blood sugar levels drop too low, that's called severe hypoglycemia. It's like your brain isn't getting enough fuel to work properly, so you might feel really confused, grumpy, or even pass out. So, whenever someone with diabetes starts feeling confused or not quite right, it's super important to get help ASAP. It's all about catching it early and keeping them safe. Fruity breath. You know how sometimes when something's wrong in your body, you can smell it? Well, fruity breath is a smell that can tell us something serious might be happening, especially for people with diabetes. See, when someone has diabetes, like type 1, their blood sugar levels can get really high. Instead of using sugar for energy like usual, their body starts breaking down fat instead. But this process creates these things called ketones. Now, if there are too many ketones in the blood, it's a big problem. It can lead to something called diabetic ketoacidosis, DKA, which is really serious. One of the big signs of DKA is that fruity breath smell, kind of like if you sniffed an overripe fruit or nail polish remover. Why is this smell so important? Well, it's a sign that something's not right with the body's sugar levels. And if it's not taken care of quickly, it can lead to even more problems like dehydration or even a coma. So, if someone with diabetes have this fruity breath smell, it's super important to get help fast. Hey! Are you loving our content and want more of it delivered straight to your screen? Then it's time to hit that subscribe button on YouTube. By subscribing to our channel, you'll never miss out on our latest videos. Join our awesome community of subscribers and be part of the adventure. Don't forget to turn on notifications so you're always in the loop when we upload new content. Thank you. Rapid breathing or shortness of breath. Sometimes people with diabetes can have some serious issues. One of those big problems is called diabetic ketoacidosis, or DKA for short. It's when their blood sugar levels get super high, and their body starts to make a lot of something called ketones, which can be really bad. When someone with diabetes gets DKA, they might start breathing really fast or feel like they can't catch their breath. This is because their body is trying hard to get rid of all those extra ketones by breathing them out. It's kind of like their body's way of trying to fix things when they're going wrong. But here's the thing: when someone with diabetes starts breathing fast or feels short of breath, it's a big deal. It means they need help right away because DKA can get worse really quickly and even lead to really serious stuff like passing out or worse. So, if you know someone with diabetes and they're having trouble breathing, or if you're experiencing it yourself, it's super important to get help fast. That way, doctors can help get their blood sugar levels back to normal and make sure everything's okay. Nausea and vomiting. You know how when you're sick, you might feel nauseous or throw up? Well, the same thing can happen to people with diabetes, and it can actually be a sign that something more serious is going on. So, when someone with diabetes has really high or really low blood sugar levels, their body might react by making them feel sick to try to balance things out. Sometimes, it's a sign of bigger problems, like diabetic ketoacidosis or hyperglycemic hyperosmolar state, which are serious complications of diabetes that can mess up their whole system. Feeling sick and throwing up can make things even worse because it can make them dehydrated and mess up their electrolyte levels, which are important for their body to work right. So, if someone with diabetes is throwing up a lot, it's super important for them to see a doctor fast. They might need help getting their fluids back up, balancing their blood sugar levels, and figuring out what's causing the problem so they can fix it. Early help can keep things from getting worse and make sure they're taking care of their diabetes the right way. Weakness or fatigue. So, you know how feeling tired or weak is pretty common when you're not feeling well? Well, in diabetes, it's a big deal. It's like your body's way of saying, hey, something's not right here. When your blood sugar levels get too high, it's called hyperglycemia. It's like having too much sugar in your gas tank, but your body can't use it properly for energy. So, you end up feeling tired and weak because your cells aren't getting the fuel they need. On the flip side, if your blood sugar levels drop too low, that's hypoglycemia. It's like running out of gas completely. Your brain and muscles don't get enough energy, so you feel weak and tired again. Now, why is it so important to recognize these feelings in people with diabetes? Because they can be a sign of something serious brewing, like diabetic emergencies. These can mess with your body and even put you in the hospital if you don't get help fast. Managing diabetes means keeping your blood sugar levels in check. That's like making sure your car has enough gas but not too much. It's possible to do this with medicine, eating right, and staying active. Recognizing the emergency signs of diabetes is important because it helps people know what to do when there's a problem. These signs are like alarms in our bodies, telling us if something is really wrong. Understanding these signs helps us act quickly. When someone knows the signs of diabetes emergencies, like vomiting, confusion, or fruity breath, they can act fast. They can call for help or take the person to a doctor before things get worse. This knowledge is powerful, it helps us keep ourselves and others safe. But it's not just about what we do in the moment. Knowing the signs of diabetes emergencies also means being ready for the future. People with diabetes can learn how to manage their condition better by checking their blood sugar and taking their medicine. Caregivers and loved ones can help by learning what to look for and how to help. With this knowledge, diabetes doesn't have to feel scary. It's like having a map when you're lost, it shows you what to do and gives you confidence. By understanding the emergency signs of diabetes, we can all work together to stay safe and healthy.